There are 3 steps to solving a problem underwater. Stop your activity, get firm control of yourself, and analyze the situation and take action based on your analysis. When you are immersed in water without proper thermal protection, heat is rapidly drawn from your body. You also lose heat underwater every time you take a breath and exhale. The deeper you dive, the colder the water. Also, the greater the pressure that works to compress your wetsuit, giving you less insulation. If your body loses enough heat, you can develop hypothermia. Symptoms of heat loss include loss of muscle strength, muscle cramps, numbness in your arms and legs, or inability to use your fingers or hands, increased breathing with no increase in activity, shivering, fatigue, and the loss of ability to think clearly. If you ignore the symptoms, your body continues to lose heat. You will develop a serious medical emergency. Your best defense in cold water is to wear the right amount of insulation for your needs. If you get cold while diving, you need to wear more insulation. Shivering indicates chilling. You must take shivering as a signal to end your diving activities. If you become cold while diving, end your dive and get out of the water. Get into warm, dry clothes as soon as possible and warm yourself. Problems with overheating usually occur on the surface as you are preparing to dive, but can occur while diving in warmer waters. If you overheat and do not act to cool your body, you'll experience some or all of the following: pale, clammy skin, a feeling of weakness and fatigue, headache and nausea, and possibly vomiting. You need to take action immediately to lower your body temperature. If you are not nauseous, you can drink cool water to rehydrate. Be sure to stay out of the sun and rest until the symptoms go away. To prevent overheating, pace yourself when donning your wetsuit, and be sure to stay out of the sun. Cold, exertion, incorrect kicking with fins, restricted circulation, or some combination of these factors can lead to cramps. If you experience a cramp, stretch the cramped muscle and massage it. For cramps in your calf or foot, pull on the tip of your fin gently as you straighten your leg. This stretches the muscles that are responsible for the cramp. Entanglements typically occur with underwater plants, fishing line, or fish nets. You should have a knife available so you can cut yourself free. Stop your activity and get control. Determine where you were caught and what object caught you. Remain calm. Avoid turning around because this will usually make an entanglement worse. You might be able to free yourself by pulling the plant, line, or net clear of you and your gear, or getting your buddy to help you. Disorientation, not knowing where you are or which way is up, can occur for several reasons when you dive. Sensory deprivation can occur during poor visibility or night diving. Sensory deprivation can cause dizziness or vertigo. Ear problems, a ruptured eardrum, or trouble equalizing when you descend or ascend can also cause vertigo. To help overcome disorientation, you must overcome the dizziness and then determine which way is up. Hold on to a solid object or hug yourself until dizziness passes. Do not close your eyes. To know which way is up, look at your bubbles. Air always rises. Equipment difficulties include gear that is or becomes improperly adjusted, undone, or lost while diving. You can adjust almost every piece of equipment while in the water if you first think about what you need to do, then work slowly and deliberately to make the adjustment. If you become excited and find yourself working hard, stop your activity, recover, think, and start again slowly. You could lose your mask, snorkel, fins, or weight belt underwater. You must be able to recover the lost item or be able to reach the surface and exit the water without missing them. Occasionally, the power inflator mechanism on your BC can stick in the open position, which causes the BC to inflate. If this happens, you must vent the excess air and disconnect the power inflator hose. If you do not, you can experience an uncontrolled ascent. If you feel nauseous while on the boat, do the following to help prevent seasickness. Avoid greasy foods. Stay out of any enclosed space on the boat. Settle yourself in the boat's midpoint where it is most stable and look at the horizon. As a diver, you have 2 responsibilities to your buddy. First, you must help to keep problems from occurring. Second, you must help your buddy overcome any problems that do occur. Most diving problems occur at the surface rather than underwater. If your buddy is in distress at the surface, help your buddy establish buoyancy. Get your buddy to relax, breathe deeply, and rest, and provide assistance as needed. If you must help your buddy through the water, you can use various swimming assists and tows, including the do-si-do position, the bicep push, or the fin push. As a diver, you must know the fundamentals of making a full rescue, even though it is unlikely. If you need to rescue someone, you will know how to proceed. Further training in diver rescue techniques is available in the NAUI Scuba Rescue Diver course. This training is recommended for every diver. A diving emergency occurs when a diver is unconscious or otherwise helpless and possibly not breathing. For a rescue at the surface, establish positive buoyancy for yourself. Make contact with the victim to see if they are unconscious. Pull the victim to a face-up position and establish buoyancy for the victim. Yell and signal for help. Remove your mask. Look, listen, and feel to see if the victim is breathing. Start artificial respiration if the victim is not breathing and the shore or boat is more than about 50 meters or 50 yards away. Continue rescue breathing as you transport the victim to your exit point. If you find an apparently unconscious victim underwater, your primary concern is to get them to the surface. Make contact with the victim to see whether they are unconscious. Pull the victim to a face-up position and check their mask. You may need to ditch the victim's weight belt to make him buoyant. If there is any water in the mask and the diver is not breathing, remove the mask so air increasing in volume from decreased pressure will not force water down the victim's windpipe. If the diver is breathing, hold the regulator in their mouth. If the diver is not breathing, leave the regulator alone. While ascending with the victim, control your ascent to the surface by venting air from the victim's BC. However, if they start to rise too quickly and you cannot control their ascent, let go and control your ascent to the surface. You cannot allow them to make you a second victim. If need be, establish buoyancy for the victim at the surface. Signal for help. Place the victim in a do-si-do transport position. Look, listen, and feel to see if the victim is breathing. Start artificial respiration if the victim is not breathing and the shore or boat is more than about 50 meters or 50 yards away. Continue rescue breathing as you transport the victim to your exit point. When giving in-water